All right, so now what we're doing was taking 1/2 of the pelvic girdle, right? So it's made up of 2 bones, all right? We're taking one of them, okay? And we're going to go through the parts. The parts that are on this one are also found on this one. So I'm going to turn it around. So as far as, orientation, the hole and the area where the pubic symphysis would be formed, that's anterior, that's towards the front. The auricular surface, the area where the sacrum would attach, that's towards the back, posterior. The fan, the big fan, is superior, and then where the hole is again is inferior. So this is being held now in the proper orientation, meaning this would be the left coxal bone. Anterior, superior, inferior, and back here would be posterior, and that's where the sacrum fits in. So now we'll go through the parts, and we can start here at the top, and we're just basically going all the way around the edge, naming the little lumps and bumps and depressions all the way back, and then the hole and the surface we can name at the very, very end. Okay, so I'm going to start here at the very top. So this is anterior, posterior. So I'm starting right here, right? And you can see that there's a little bump here on the front. There's a large one and a smaller one, okay? So we refer to these as spines. This is the anterior superior iliac spine, okay? Because it's in the front, anterior. It's above this one, superior. And it's a spine off of the bony part that was once referred to as the ilium. Okay, remember this was made up of 3 bones, the ilium, the ischium, and the pubis. So they call it the anterior superior iliac spine. Anterior inferior iliac spine. It's below it. Okay? Muscle attachment points. So we'll go across the top. Iliac crest. All of this. Okay, sometimes people say put your hands on your hips. That's exactly what you put your hand there at that bone. But the true hip joint is a couple inches below that. Coming here, we'll go to the back. Again, there's 2 spines there, like in the front, superior and inferior, superior and inferior. Okay, so this is the posterior superior iliac spine. Posterior superior iliac spine. Posterior inferior iliac spine. Then we come into this big depression. That's the greater sciatic notch. Then there's an ischial spine, another little piece that sticks up. And now we're on the ischial bone. And then the lesser sciatic notch. Some of the nerves, the spinal nerves that contribute and become the sciatic nerve, pass through these notches. Then you come to this large bony area. And that's actually these 2 areas here. That's what you actually sit on. When you sit down, that's what you rest on. These 2 bony prominences. Of course, it's covered by muscle and fat and skin, but that's what you sit on. That's known as the ischial tuberosity. Okay? So we're coming down, greater notch, lesser notch, ischial tuberosity. Okay? Then you come to the area where there's this hole. This is the obturator foramen. Okay, the obturator foramen, it's called. It's kind of constructed by these 2 bridges of bone. Okay, this is a ramus, the inferior ramus, and this is a ramus, the superior ramus. Okay, now, the book breaks this ramus into 2 pieces, okay, because part of it comes off of the pubic bone and then meets up with part of it coming off of the ischial bone. All right, for our purpose, this is the inferior ramus. All right, they have part of it described as pubic ramus, part of it described as ischial ramus. Inferior ramus, for our purposes, which would make this the superior ramus for all purposes. All right, we'll keep it simple. Superior ramus, again, it's an extension off of the pubic bone, meeting up with a piece coming off of the ischial iliac component, and this is the inferior part of it coming off of the pubic, part of it coming off of the ischial. Inferior ramus, superior ramus. All right, so here we were. We came off of the ischial tuberosity to the inferior ramus, and that brings us to the pubic symphysis, right? Where this piece of cartilage is, the cartilage is sitting right here, pubic symphysis. Now we're on the pubic bone. Little bump just beyond the symphysis, pubic tubercle. Then we're on the superior ramus, and then we're back to the anterior inferior iliac spine, anterior superior iliac spine, back to the crest. So we went all around the horn. Obturator foramen, and then this deep joint surface. This is the acetabulum. That's where the beautiful round head of the femur fits in. That's your true hip joint, a beautiful ball and socket joint. And then last but not least, we mentioned it earlier, this rough surface here on this ilium is the surface, matches up with the rough surface of the sacrum. This is the auricular surface of the sacrum. This is the auricular surface of the coxal bone. They lock together to form the sacroiliac joint.